In the previous video, we have discussed what is receptor and different drugs that they work through receptors. Now let's discuss a concept called as regulation of these receptors. Now regulation of receptor, there are two types of regulations. One is called as the up regulation of the receptors and the second is called as the down regulation of the receptors. So first we will understand what is up regulation and down regulation of the receptors, and then we will also discuss what is the clinical implication or clinical consequence of this up regulation and down regulation of the receptors. Now if the drug is, suppose there is a receptor and that receptor is deprived of the agonist for a very long period, or if that receptor is being continuously exposed to antagonist. So two things. One is that either the receptor is deprived for a longer duration for agonist, or the receptor is continuously exposed to an antagonist. Then that will result in increase in the density of the receptor, which means increase in the number of receptors as well as increase in the sensitivity of the receptors. This is called as the up regulation of the receptors. On the other hand, if that receptor is continuously exposed to an agonist, then it will decrease the sensitivity of the receptor, and that is called as the down regulation of the receptor. So if the drug is continuously exposed to agonist, the receptor will have a down regulation. Now let's understand what are the consequences of this up regulation and the down regulation by taking some clinical examples. If there is a patient who has been on beta blocker for a prolonged period, now beta blocker is an antagonist. Now if beta blocker is been continuously given, the receptors, the beta receptors, they undergo up regulation, because we just now said that if the drug is deprived of agonist or continuously exposed with antagonist, then there is a up regulation of the receptors. Now go back to the same patient. That patient was taking beta blockers for a longer period. Now if you suddenly stop the beta blocker, because there is already up regulation of the receptors, there might be precipitation of angina. Therefore patients who are on the continuous use of beta blockers for a longer period, they should be tapered off slowly, because if continuous exposure is being given, that results in the up regulation of the receptors. Now let's talk about the down regulation of the receptors. Patients with asthma, if suppose they are taking beta 2 agonist and beta 2 agonists are being given continuously. So now the agonist is being given continuously. So what happens? There is a down regulation of the receptors. That means if agonist is being taken for longer period, then over a period of time, the response to that drug might decrease, the responsiveness of the drug might decrease, and that is called as the down regulation of the receptor. Just to summarize, denervation or prolonged deprivation of the drug, deprivation of the receptor from the agonist, or continuous exposure of antagonist, that will result in the up regulation of the receptors. Whereas if the receptor is continuously exposed to an agonist, that will result in the down regulation of the receptors. Thank you.